When we talked in the White House and throughout the early stages of healthcare reform discussion, you talked about the absolute need to bend the cost curve of healthcare, that we had to bring costs into line or we're going to break the country. If there's no government insurance program, if we're not even going to expand Medicare to keep insurance companies competitive, how does the cost curve bend?
Well, a couple of things. Number one, and something that hasn't been discussed, partly because there's been some broad-based agreement on this, we're setting up an exchange in which you've got 30 million people and small businesses who are now able to pool their buying power and negotiate essentially with insurance companies by choosing the best price from a range of different plans, forcing insurance companies to compete the same way they compete for the business of federal employees. That drives costs down. Every single what's called game changer, every idea that's out there about changing delivery systems, how hospitals are billed, how doctors are reimbursed, how we can incentivize them to plan better, reduce numbers of tests in order to improve quality of testing and diagnoses. All those things are embodied in the bill.
And then there's the problem getting the darn thing passed, yes. Which is proving to be devilishly difficult.
Yes.
You thought you had a compromise last week that was going to expand Medicare to younger people. Then Senator Lieberman says, well, I'm not sure I want that. And then all of a sudden we hear it's out of the bill. Do you feel as if individual senators are holding you hostage?
I think that what we have right now in the Senate is a situation where the opposition party has made a political decision that we are going to say no to everything. We're going to not be at the table. We're going to just not get involved.
Which leaves you needing all 58 Democrats and 2 independents.
What that means is
every one of them.
Every single one of them.
Every single one.
Every single one of them. And look,
anyone can say to you, if I back off, you have to do what I need you to do.
You know, I spend a lot of time talking to individual senators.
Yes, you do.
And it's not just on healthcare. I mean, there are healthcare is the most prominent example, but you know, one of the.
But do you feel like they're holding you hostage on this?
Well, here's what I'll say. Each of them have very strong opinions.
Don't they ever?
And
you think?
You know, many of them, I think, sometimes feel that they've got a better idea than we do. We try to incorporate as many as possible. The problem is each one of them may have ideas that are completely contrary to what the other senator wants. And so there is a balancing act. You've got to have a sense on the part of each individual senator that every once in a while.
Do you think there's 60 senators doing that?
Well, I think it's hard. And there's got to be a sense sometimes that we're willing to rise above our particular interests, our particular ideas in order to get things done. Right now, that culture has, I think, broken down over the last several years, and one of my jobs over the next 3 years is to try to see if we can revive that. But that's tougher than I would have liked.
But when you need every vote like this, and when senators can do this to you,
right.
And those are my words, not yours, a lot of people worry that what you're going to wind up with is hash. There's even some Democrats saying, now we've got a bill that's so compromised that it's not worth signing.
This will be the single most important piece of domestic legislation that's passed since Social Security. And I have confidence that we're going to pass it. There's a reason why 7 presidents and 7 Congresses failed to get this done. It is really hard, but it is going to get done. And if we don't pass it, here's the guarantee that the people who are watching tonight, your premiums will go up, your employers are going to load up more costs on you, potentially they're going to drop your coverage because they just can't afford an increase of 25, 30% in terms of the cost of providing health care to employees each and every year. And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable, and this actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid. So anybody who says that they are concerned about the deficit, concerned about debt, concerned about loading up taxes on future generations, you have to be supportive of this health care bill, because if we don't do this, nobody argues with the fact that health care costs are going to consume the entire federal budget.